I've attended a few of your presentations, and you use breath through your presentation, and I've picked up on it. You use it to help people learn, to retain a new concept. You'll get people to, you'll throw out in the middle of a sentence, everybody take 2 deep breaths, bam. And like people, it's kind of you're getting the brain to pay attention, and then you're providing the oxygen for it to do that. I think those are amazing tools that you use. Can you talk a little bit about, so I want to talk about, yes, the breathing and the airway part of it, but also in dentistry, the the part that you add that I see more than most is the nutritional piece.
Mhm.
And you talk a lot about the gut biome. How does the way we breathe, the way we sleep affect our nutrition, our gut biome? Is it connected or are they two completely separate things?
Yeah, a great question. Everything in the body is connected to everywhere else. That's why if you have a pregnant patient, they'll say, I feel pregnancy in my feet. So the feet know you're pregnant. Anything affects everything else. Just think about it. If you have a dysfunctional airway where it takes you all these muscles, scalene, occipitus, and sternocleidomastoid, if they're all working harder because you have poor posture, think about it. People think, oh, my neck's sore. I need to get a new pillow. Or my neck's sore. I need to get a massage. No, you don't just need a massage. You want to see what kind of posture you have. How high is your computer when you're sitting? When's the last time you changed your mattress? The mattress, they say, has a lifespan of 9 years. If it's been 15 years, your mattress has a sloop to it. Pillows need to be changed often. People often have what's called classic is a forward head posture.
Yeah.
People often think when someone is over 60, the forward head posture is from a lifetime of looking, but they said it's the body trying to get air into the brain easier. Our posture is a slave to our breath. So forward head posture is not just from texting, it's actually the body trying to get oxygen to the brain. So it's all powerful stuff. And I think there's no clear answers yet. I think more study is needed. But just being aware of it, Tony Robbins said, awareness is the first step to change. And if you're not aware that you have poor breathing patterns, and this is why your neck's always sore, you don't just need to get your head cracked. What you need to do is start looking at your sinuses, start looking at your tonsils, start looking at if you're eating foods that not necessarily allergic, but that you don't tolerate well. So if you're eating foods all the time, and the tonsils, this tonsillar ring, Valdev's ring right here, if we're always putting food down that's annoying it, they're swollen to look at all the pathogens. Now with this tonsillar ring, which is swollen, which is adenoids, tonsils, what happens is now you get more resistance to airflow. And now the brain's going, where's the oxygen? So now the brain's going forward head posture. Now the body's got to make more mucus. And now you got to have a postnasal drip. Now you're putting over-the-counter postnasal drip stoppers in your nose. And now so then you get in a car accident with the forward head posture. And so between the car accident, the forward head posture, the postnasal drip, the food that you're eating, at what point do you start? Like, we're talking like, it's like a maze of where to start. And if you just take ibuprofen, or if you just get your head cracked, or if no one looks at breath, this is where people spend 5, 10, 15 years trying to get better. And if you're trying to get better for 10, 15 years, think about sympathetic nervous system activation. Then you start thinking of adrenal fatigue. Now you have poor sleep, and now you have depression. And depression is one of the top 4 reasons for long-term disability. And is it because you have dysfunctional breathing, that you're off work now? So it gets you can see it. It's like I'm driving in Sydney, Australia. Like the streets are like a spaghetti. Everything affects everything else. So when some practitioner says, "Hey, I can fix that," no, you got to work like almost like a Mayo Clinic style team. You got to work with maybe a nurse, a physician, a psychologist, a dietitian, a trainer, an ergonomic specialist at work. It's as I'm talking, I realize, wow,
Yeah.
wow.
Yes. So now you can understand why it's such a huge issue. And even when we started this and we thought about doing 12 hours, 12 hours doesn't seem like enough time because literally you start going down this rabbit hole and it can take you everywhere. Imagine how our poor patients feel when they show up at the doctor's and they know they don't feel right, but maybe the blood work they had done is all within normal limits.
Mhm.
And so they're at a loss because we're just not picking up the clues that our patients need us to tie into to start with. So if you're saying we're a slave to our breath, then shouldn't that be the very first thing that we look at?
Well,
It's
unless you've been trained on it, unless you've taken courses. So if you go, so poor low energy is one of the top reasons for going to the doctor's office, and poor sleep. Low energy, poor sleep. Where does oxygen fit into low energy? And if oxygen is part of that, and then if your muscles are chronically activated or tense, and one reason for poor sleep is sympathetic nervous system activation from chronic pain, not 9 out of 10, but 3 and 4. Now you have poor sleep. So now you don't go into spend time in stage 3, 4 sleep. Those little muscles aren't healing. You have higher blood pressure. You have higher adrenal fatigue. It's yeah, you really need a team approach. I really feel you really need a team approach. So the people that are getting this the most though are high-end athletes. So a lot of athletes in California, you hear about them getting palatal expansion. You get them talking about getting surgery to anything to expand their airway. And if Olympic athletes, they could win a race by 100th of a second. So if I get gold, I'm 100th of a second ahead of you, let's say, I go down in history and no one remembers that you were there. So I follow where elite performers stay. Like they want not just to be, most people just want to be pain-free. Doc, I just want to get rid of this pain. Michael Phelps goes, I want to be the fastest swimmer in the world. So two different needs. So I'd love to be a fly in the wall of their physiotherapist's office, their doctor's office, their dietitian's office, their psychologist's office, their sleep office. You know, like Michael Phelps sleeps 11 hours a day. I've never heard of that unless you have someone has a 2-year-old. He sleeps 11 hours a day, eats 12,000 calories a day. So,
wow. But he burns it. He burns
for
it and
sure.
he needs to restore. If sleep is where we heal and restore, then after you've exerted that level of effort, it makes sense. It makes sense. And yet we still are priding ourselves on skimping through life on 5 or 6 hours of sleep a night. So clearly a lot more education we need to do.
Yeah, but the whole for sure, and the whole obesity epidemic, Julia. So I think it said in 1985 there wasn't one state in the United States that had more than 10% obese people in the population. 1985, not more than 10%. Now, in 2020, every state has more than 35%, or
Oh my
one third,
word.
1 in 3 people. So if there's 330 million people, 110 million Americans, 1 in 3, are obese. So people just think of obesity. They think of their stomach, they think of their arms waving goodbye at the airport. No one thinks of the neck and the airway.
Yes.
And one of the big contributors to sleep apnea is a short neck, a thick neck on someone who's overweight. So 1 in 3 obese, 7 out of 10 are overweight. So think of the size of that airway shrinking as someone gets to be obese. You know, the 5'6" woman at 250 pounds. How could her airway be just as patent as someone who's 125 pounds at 5'6"? So now they have an appliance, they have sprays, they're getting their tonsils out, they're having postnasal drip, they're getting massage. Hey, let's talk weight loss. You know, you need to get down to a BMI that's conducive because that opening stays that same constricted size. No matter how much you spray, no matter how many adjustments you have,
Right.
no matter how much massage you have, no matter how many allergens you take out of your diet or food intolerances. So you really see how you need a multifactorial onslaught of experts to get this better. But airway is number one. As you said, we're a slave to our breath.
I was thinking about when you were talking about the tonsils being inflamed, the ring of tonsils being inflamed, and when you have inflammation, you have fluid buildup. And so you see that soft kind of neck that's bulging out, similar to inflammation in the gut. And then you get the bloating in the gut. So it's kind of like a bloating of this area from being overloaded with all the junk food and additives and things like that. And
Mhm.
then you could go down the whole train of vitamin D and supporting sleep and airway and breathing and reducing inflammation in our tissues. Like there are just literally so many avenues.
Well, look at magnesium. I think I read that up to 80% of the American population or North American population is low in magnesium. They said magnesium is needed at good amounts every day for muscles to relax. So tense muscles, the sleep's not deep. Tense muscles can't even help you be a slave to your breath. So now they're inefficient. Like if the scalene, occipitus, and sternocleidomastoid and digastric are all trying to help, now you have magnesium low, which doesn't allow you to sleep deep, and the muscular tension's high. You have an inefficient way to struggle to get the breath in. And now you have that forward head posture. So get in a car accident with a forward head posture. So now the forward head posture, that back of the seat is about 4 inches away. Think of that now as in any kind of car accident, or the forward head posture from the side, those accidents. Think of the incapacitating, like a 10-year rehab of someone, all because of inefficient breathing, or swollen Valdez ring, tonsils, or poor sleep from low magnesium, poor sleep from low vitamin D, poor sleep from 1 in 3 being obese. Like, we can't just fix it by an advancement appliance from a dentist. You can't just fix it from a CPAP. You got to stop people smoking. 20% of the population smoking. So 1 in 5 people smoking. What's the airway like? What's their Valdez ring like? What's their sinuses like? So this is wild stuff. It's you can have a good debate and a really good discussion if you get 9, 10 healthcare providers from different industries in a room. There'll be a very robust, energetic discussion. I wouldn't say debate, because we'd all go, wow, where do we start? Who's going to pay for this? Sleep study, $3,000. Sleep study's $3,000.
Yep.